In this video tutorial, I am going to discuss pulmonary surfactant and its clinical importance. Why do premature babies struggle to breathe right after the birth, while full-term babies don't? Why? The answer lies in a very important substance missing from premature baby's lung, and that substance is surfactant. Surfactant is a special substance synthesized by type 2 pneumocytes in the lungs. Now, what exactly is surfactant made of? Chemically, it is a complex mixture of lipids and proteins. Lipids making up about 90% and proteins making up about the remaining 10%. The major and most important lipid here is dipalmitylphosphatidylcholine, or DPPC for short. It is also known as dipalmitoylphosphatidylcholine, or simply you can call it as a lecithin. And this is the star player. Other minor lipid members include phosphatidylglycerol, cholesterol, and other lipids. This protein part includes surfactant protein A, B, and C. Now, before we understand the problem, let's talk about alveoli. Suppose these are alveoli. And remember, single unit is called alveolus and multiple units are called as alveoli. These are tiny balloon-like air sacs in the lungs. It measures just about 0.2 to 0.5 millimeters in diameter. They are responsible for gas exchange. So oxygen goes in and carbon dioxide goes out of the body. Here is where it gets interesting. The inner wall of each alveolus is lined with water molecule. Suppose these small circles represents water molecule. These water molecules attract other water molecules through hydrogen bonds with neighboring water molecules. This creates an elastic-like tension called surface tension. And here is the problem. This surface tension creates inward pull that would make impossible to keep these tiny fragile alveoli open, just like a wet balloon wants to stick to itself. So alveoli can collapse like this. If alveoli collapse, gas exchange become impossible. And this is where surfactant comes to the rescue. Surfactant molecules insert themselves between the water molecules on the alveolar wall. Suppose these red tiny circles represents surfactant molecule. When surfactant is present, water molecules can no longer form hydrogen bonds with all their neighbors. The surface tension drops drastically and the alveoli will not collapse and stay open. This is so simple yet so brilliant. Now, here is the critical part. Surfactant, especially dipalmitylphosphatidylcholine, production by fetal lung starts around 30 to 32 weeks of pregnancy, and it reaches at its full production capacity only after 34 weeks of gestation. And normally, baby is born after 40 weeks of gestation, which is called as a full-term birth. During pregnancy, the fetus doesn't actually need surfactant because gas exchange happens through the placenta and not the lungs. But the moment the baby is born and takes that first breath, gas exchange immediately shifts from placenta to the lungs. And so surfactant become absolutely essential immediately after birth. So what happens if baby is born prematurely? Let's say before 34 weeks. That baby has a decreased surfactant. And without enough surfactant, surface tension goes up, the alveoli collapse, a condition called atelectasis. This leads to impaired gas exchange as explained earlier. The newborn struggles to breathe, developing what we call as a acute respiratory distress syndrome, or ARDS. It is important to note that acute respiratory distress syndrome can happen at any age, not just in the infant, but the cause is going to be different. In adults, it is generally due to lung damage from infection, injury, or aspiration. But in case of preterm infants, it has this unique cause, and that is lack of surfactant. We can actually predict fetal lung maturity before delivery by testing amniotic fluid. We can measure LS ratio in amniotic fluid. Here, L stands for lecithin, which is just another name for dipalmitylphosphatidylcholine, and S stands for sphingomyelin. A ratio of 2 or more indicates lung maturity because there is a natural shift from sphingomyelin synthesis to dipalmitylphosphatidylcholine synthesis around at 32 weeks. And here is the good news. We can intervene. Preventive and curative, both treatments are available. In case of before birth, if premature delivery is expected, giving the glucocorticoids to mother shortly before delivery can speed up lung maturation by turning on specific genes in the baby's pneumocytes. After birth, if the baby still struggles to breathe, we can give natural or synthetic surfactant directly into the baby's airway through a procedure called as intratracheal instillation. These treatments have saved countless premature babies. So that's all about pulmonary surfactant, a small molecule with massive clinical importance. If you have any doubts or question, drop them in the comments below. I will be happy to clarify. Thank you.